Seems like forever. Repairing a heart valve meant cracking the chest, big surgery, grueling recovery. But what if I told you that a new method could mean healing the heart with a lot less heartache? Let me introduce you to the team that is advancing this less invasive approach, Steve Sandweg and Dr. Isaac George. How are you? Nice to meet you. Have a seat. So, for whom is this designed? Less invasive cardiac valve repair or replacement?
This is repair. This is the heart, and we have the mitral valve here. The mitral valve is a valve that helps collect blood from the lungs. It then gets pumped out. When the heart isn't beating well, the mitral valve can leak. The blood goes backwards and goes back into your lungs, and you get shorter breath.
The other thing that I think is important for people here in the audience and at home is it's incredibly consequential. If left untreated, and if you're a non-surgical candidate, at 5 years, the mortality rate's pretty high. It's around 50%. So something's got to be done.
The ring that we do in cardiac surgery is very similar to this. We take sutures and we sew this in. We stop the heart, we go on the bypass machine, but we sew this in. And this is the ring that we put in with open surgery. This is the ring that we're able to put in with a catheter. The procedure takes about an hour.
Nothing.
And so no incisions, no bypass, no stopping the heart.
Valcare has designed a ring to essentially treat those patients that are considered non-surgical, but doing it in a way that is less invasive, right? So the ring, as Dr. George pointed out, this is a surgical ring. Our ring is similar in the sense that it's a D shape, just like a surgical ring, but it's delivered on a catheter via the groin, right? So it's less invasive.
One of the really important things to remember here is that the ability to repair a valve is paramount for the mitral valve.
Yeah.
Repairing your valve keeps your own valve tissue. So we're looking at taking a disease that potentially limits people's lifetime, fixing it one time and having a durable result over a patient's lifetime.
Well, to be clear, this is presently an investigational device undergoing clinical trials, but let's take a deeper look at how this works.
I'm a cardiac surgeon. I do open heart surgery. I'm used to open chest. I'm used to stopping the heart. I'm used to bloody situations. And I decided to take time to study that and to learn how to do this and become an expert in this. It's allowed me as a surgeon to be a better surgeon. It's allowed me as a transcatheter structural cardiologist to do cardiology better as well. In the past, we've relied on open heart surgery. Open heart surgery is invasive, typically done from opening your chest. We put a patient on the bypass machine, which is the heart-lung machine, and it takes a long time to recover. It's a very invasive procedure. These procedures that we're doing now are new procedures. They're novel procedures, and we're building on now decades of experience with catheter valve technologies. Specifically for mitral valve disease, when the patient's mitral valve is leaking, we oftentimes use what's called a ring. We're putting around your heart valve. Instead of sewing this in though, we tried to do this with a catheter, and now we are able to do that. This is a really transformative thing to think about, that we can do open heart surgery without the open heart part. We can reduce the rates of major complications such as bleeding, stroke, heart failure. No blood thinners when they go home. It's a better recovery. It's a quicker recovery. It allows us to do almost all of the same things that we can do in open heart surgery by replicating it and doing it just as well. And it opens a whole new world for our therapies.
So this is really a big breakthrough. Well, thank you very much, gentlemen.
Absolutely. Thank you, Dr.
Pleasure.
If you want to dive deeper into the science and these procedures, visit valcaremedical.com. Up next, a little bit more on how our oral health is connected to the rest of our body, including our heart.